Thank you very much, Sheila, and thanks to the legislators for joining us this morning. We appreciate that. And I'm just going to give a really brief history of the 874K Coalition. And as Sheila said, I'm a wheelchair user. I sustained a spinal cord injury back in 1982. And this was really important to me as a person with a disability on a personal level, regardless of the fact that I actually work at a disability resource center where we try to advocate for improving services for people with disabilities. But just on a personal level, for me, the actions and issues that we address at 874K were really, really important to me. And we started this back kind of a piggyback with when the Kentucky Disability Coalition was having a breakfast for legislators, and it started to wane in the participation and the number. And we didn't want to see that involvement from the disability community throughout the state of Kentucky dissipate. So we started to form the 874K Coalition. And we take our name from the 2000 census, where at that time it was reported that 874,000 Kentuckians, minus those in institutions and under the age of 5, that was the number of people in Kentucky that had disabilities back in 2000. And that's the largest minority in Kentucky, and the largest minority in America are people with disabilities. So that's a large, about 23% of the population of Kentucky have disabilities, or maybe a little bit more. And we really think probably the number is closer to 1 million Kentuckians with disabilities now, 874K, but that's our name that we've been known for 20 years. So we keep that because it was a recognition. And we did start out at the Civic Center with our breakfast, and then with transitioning to the 874K Coalition gatherings, because we tried to keep it centralized for Kentuckians, because as some of your constituents will probably let you know that have disabilities, transportation is a tremendous problem for Kentuckians with disabilities. So we tried to make it one central place at the Civic Center in Frankfort, and we had legislators come over to us. And throughout the years, that would kind of be a problem because of the inability for them to get out of their meetings, their subcommittee meetings, to come to join us. But they did make every effort, and we were very fortunate to have at least 2 times where we had gubernatorial candidate forums at our breakfast, and we asked them disability related questions, and the candidates on both parties showed up for our forums and participated, and we had a number of legislators that came. But as a lot of you all know, that the Civic Center decided that they were going to be closing, and us recognizing the issue of the problem for the legislators getting there, we decided to move our efforts to the Capitol itself and to the Rotunda. And I think we all feel that this was a really good move on our part. And I should go back and say the members that really started this, as Sheila said, myself and herself and Steve, but we also had the ARC of Kentucky and the Commonwealth Council on Developmental Disabilities, the Mental Health Association, or Kentucky Association of Regional Providers, and the Brain Injury Association. We've had a different group. We've got physical disabilities, we've got intellectual developmental disabilities, mental health. We are a cross-disability organization who welcomes participation from all Kentuckians, regardless of their disability. So we try to encompass all disabilities. So we did move to the Capitol, and we were, I think we had a good opportunity to enlighten not just the legislators about the disabilities, but also the Capitol staff. And sometimes they may have seen us as an issue, a problem, but accessibility issues in the Capitol for those of us who have physical or use mobility devices. I think we've educated some of them about those issues. But we would come to the Capitol, and we've been there for probably the last 12 years, perhaps. And we have one of the largest, if not the largest, rally every year in Frankfort for those of us with disabilities. And we are trying to educate and the legislators about the issues that are important to the disability community throughout the state of Kentucky when we're talking about access to programs that would help a lot of us live in the community who are setting of our choice, which we think is really, really important to have choice in the programs regarding to our waiver through Medicaid, the waiver programs that allow people with disabilities the opportunity to live in the community. And I think choice is one of the first and foremost opportunities that we need to have, and that we've always thought about that in our rallies. And a lot of times our rally central themes have been about the investments to Kentuckians that the legislatures that you all as legislators make on the disability community and our Kentuckians with disabilities, and that it's a good opportunity for, we think, to give you some information about those of us with disabilities who can live in the community and actually save the state money, the taxpayers' money. When you see the cost of a nursing home between $48,000 to $64,000 a year, and when you see some community-based services that are as low as $20,000 a year, you can serve 2 to 3 people in the community at a better quality of life, at a better savings to the state. So we've tried to enlighten our legislators about that through our efforts at the Capitol, and we've been fortunate again having in the rotunda right outside the governor's office. I think we've had the governor come just about every year, but maybe a couple, and participate, and the cabinet secretaries and legislators like yourselves come and join us and hear the message that we are trying to relay to you all as basically the individuals that have a lot of control over disability, Kentuckians with disabilities, their lives. And we just want to, help you all see the benefit from us as a resource for you all to talk to any of us about some of the issues that you all may have. We've been, I've been fortunate enough, like I say, I've been going up to Frankfurt for 20 plus years, and this group has been a big part of enlightening our elected officials about some of the hurdles and the barriers that Kentuckians face, but also, like I say, being a resource for you all. And some of the legislators have my cell phone number and call me about disability related bills, and I'm happy to share that. But this is just a broad group of disability, where some of us have disabilities ourselves. We are agencies that we represent people with disabilities, but we just want to be a resource for you all and try to enlighten you all to some of the issues and some of the ways that we think we could benefit improving the quality of your constituents who have disabilities and live in your areas. And we just want to be a resource for you all, and hope that you all will be able to attend our event that's later in the year, and that you won't hesitate to reach out to us. And we just appreciate again that you all being here and listening to about the 874K Coalition.
You're muted, Sheila. You're muted.
That'll be the 2020 and 2021 phrase of the year, right? You're on mute. Let me turn now. Thank you, David, for that. Let me turn now to my co-chair, Katie Bentley, who is the policy director at the Commonwealth Council on Developmental Disabilities. And Katie's going to tell us about CCDD. Thank you,
Hello.
Katie.
Thank you. Hello. First, I want to apologize for my voice. I want to thank you all for being here with us today. We really appreciate your time. On top of the things that Sheila's told you about me, I also want to add that I have a son who's a teenager who receives the Michelle P. waiver services. Disability is my life and my job. It's very important to me. My job at the council, many of you probably received information about the council. We sent out some folders, but we are the state DD council. And so we are a 26 governor appointed member council that creates a 5-year plan. We are funded under the DD Act, and we have monies that are used in Kentucky to create projects across our state. Now, the funding mandates us to advocate and create systems change for people with disabilities and their family members. So we have had numerous projects, employment, transportation. We are also a resource. Sometimes in your communities, your constituents will reach out to you and they're looking for resources. This coalition is one of the best places to be, because if we don't know, and I don't know everything, but I always use the phrase, my friends do, this is one of the best coalitions that I've ever been a part of. And we use our resources for the good of every person. So please take us up on that and allow us to help you. If you're working on a piece of legislation and you want more information, want to know how it impacts people, if you are looking for some resources for someone in your community. I also wanted to tell you that we at the council have a program called Kentucky Partners in Policymaking, and that program it's a national program, but it's created to give people, citizens, their family members, and people with disabilities an opportunity to have an impact on policy. And the hope for Kentucky, because our program is really new, is that some of our folks will learn enough about policy that they too will want to be state legislators or congressional leaders. So we have a lot of great things going on. Everything that we do at the council is public. We are not lobbyists, but advocates and resources. So please feel free to take us up on that. Let us know how we can help you. And again, I want to say that this coalition has the best resources that you could possibly need to learn about disability issues, not just our organizations, but our connections to citizens across the state. Thank you for your time.
Thank you, Katie, and your voice lasted. Rest a little bit. Thank you so much. Let me turn now to Donna Fox, who is with the Center for Accessible Living, and she's going to tell you about the center and also about their YES program. Donna?
And thank you for joining us today, everybody. My name is Donna Fox, and I am the Youth Transition Coordinator at the Center for Accessible Living. As David had mentioned earlier, the center is a disability resource center for individuals with any type of disability from birth until death. Our goal is to help individuals to live the best life that they can. We have many services that are offered at the center. We have information and referral, which so if we don't provide a service when someone calls, we can refer them to an agency that does. And of course, we have David, who is wonderful and heads up our advocacy department. We teach individuals who are wanting to stay home and live in the community independent living skills training. We have peer support programs. We have a housing assistance program and a personal attendant program to help those who are staying in the community. We also have a ramp builders program. And I think one of the most amazing programs that we do have is we have what is our CWIC program, which helps individuals who may receive SSI or SSDI, but want to return to work. And this program discusses the incentives to do that, as well as help individuals who want to either get off of their benefits eventually, or who just want to try work out to see how that's going to happen, but it not affect their benefits, because after all, many of the individuals we see rely upon those benefits and their health care. We have a deaf services department and an employment service department, which will help individuals who are seeking jobs to hopefully land in the job that is best suited for them. I think that leads me to the program I love to discuss the most at the Center for Accessible Living. As the Youth Transition Coordinator, I get to coordinate a program called YES. And YES stands for Young Empowered Self-Advocates. And what we do in the YES program, besides have a lot of fun, is we like to teach individuals while they're young that it's important to learn self-advocacy. It's really important to learn to speak up, whether that is speaking up at the store when they felt like they've been done wrong, or just telling a friend, I don't want to see a horror movie because they scare me, or maybe it's something like a legislative issue that we're dealing with. And we go into, currently the YES program is going virtually into 13 schools. We go into schools in Bullitt County and Jefferson County. In Jefferson County, we are currently in 11 different high schools where we virtually see students who have disabilities and teach them self-advocacy, self-awareness, and self-determination. And then we also have community meetings, which now are also virtually too. And those meetings also address issues of self-awareness and self-determination. The foundation is basically, as a person with a disability, number one, you need to know who you are. You need to know things about yourself. You need to know what your disability is and how it affects you. And then when you're making those decisions in life, those decisions will be a lot easier to make if you're aware of who you are. And then we take that into self-advocacy. You know who you are, you know what you want. Now, how do we advocate and ask for it? So we do a lot of things in the program, and we're really excited to be with the Center for Accessible Living so that we can get this program out to as many people across the state. We are also currently in the Bowling Green area and the Murray area. So we're really expanding and really excited. And I do have my assistant on the call that I'm going to ask for just a second, if she will, Miss Stephanie, if you would like to tell these guys about the AIM program.
Hi, as Donna was saying, I'm her assistant Stephanie in the youth transition, and what I'm in charge of is a program called Yes Advocates in Motion, or Yes AIM, and it's taking the basic message of yes about self-advocacy, and it's moving it into more of a policy level. What kind of policies are going to benefit people with disabilities, and really advocating for those policies with legislators. And just basic information on how our system works. So it's pretty new and it's just starting to come up off the ground, but I'm very excited about it.
Thank you, Stephanie. We're glad that you were able to join us. Stephanie's been a part of the planning team along with Donna. And thank you, Donna, for that excellent description of the center. You all will be able to meet some of her Yes folks because they're going to play a very prominent role in our virtual 874K gathering on February 17th. Let me turn it over to my friend and cohort, Steve Shannon, who is with the Community Mental Health Centers. Steve?
Thank you, Sheila. I appreciate you all being here. I know it's a busy time. You're trying to figure out what's taking place and what's going to happen. So taking the time to meet with us on important issues. I think it really impacts every Kentuckian, just not the folks David mentioned. Everyone's impacted by what 874K tries to do. The mental health centers and CARP, and I'm the executive director of CARP, and CARP is the Kentucky Association of Regional Programs. We're an association of 11 of the 14 community mental health centers. Briefly on CMHCs, there's 14 of those. Actually, with the legislators present today, 7 of the 14 are represented. As you went through your counties, I counted that up. So we got half of the state covered today. It kind of speaks to how large the CMHCs are in many places. But they range from 5 counties to 17 counties in size. They have a specific geographical area that they serve and support, and they are the behavioral health public safety net, providing mental health, addiction, and intellectual development disability services to their region. Regardless of ability to pay, whether private insurance, Medicaid, or not covered, don't have insurance, we provide services. And we provide those 24/7. And another thing that makes CMHCs unique is we're established in statute. We are specifically identified. We're a creature of the General Assembly, passed in 1966. KRS 210 includes the CMHC section. And it really outlines what our mission is, what we are supposed to do. Back then, they talked about alcoholism, but clearly it's over time, 1966, most of the issue was alcohol, has moved on to drugs. Obviously, opioid has been a big impact on us the last 4 or 5 years. But again, and in terms of the scope of what we do, we employ about 7,500 to 8,000 people. 1 in 200 working Kentuckians is employed by a mental health center. An economic force that we sometimes forget about. And that includes individuals who are direct support, working one-on-one with people, running group homes, working day programs. We have peer support specialists for people with mental illness and addiction. We have a full array of therapists, psychologists, social workers. We have accountants, we have attorneys. We have advanced practice registered nurses providing both psychiatric services and primary care. Legislation was passed maybe 8 years ago, Sheila, 10 years ago. It permitted the community mental health centers to provide primary care. And it really came out of the notion and evidence, research study, that people with mental illness die 25 years younger than the people without mental illness. Similar demographics, 25 years, and primarily accountable to issues relating to the mental illness, whether it's their housing, whether they been homeless and they have Hep C, smoking, whatever it is. So primary care became an important piece. We provide, so we do that as well. So we have primary care, AARPs, we have doctors, and we have psychiatrists. We also, but most significantly what we do is we serve and support somewhere between 175 and 180,000 of our friends, neighbors, family members, coworkers, classmates, church members. It's about 1 in 25 people, 1 in 25 access. There's 15 on this call. 10 more people on this Zoom meeting would represent one of those to be at a mental health center. 1 in 25 access services. And we're 24/7, so it's all time. We had staff on call Christmas Day. We had staff working Christmas Day, as many other folks did, but on call in case there's a crisis. And we provide mental health services, addiction services, and service people with intellectual and developmental disabilities, whether it's a day program, whether it's therapy, whether it's a staff residence where they live 24/7. We have 24-day substance use residential programs for people. We have follow-up services, a wider range of things that we've done for all those folks. And that's really what drives the mental health centers, is those 1 in 25. Also, we're the result of federal legislation. I always want to put this in. President Kennedy signed the Mental Health Act on October 31st, 1963. It was the last piece of legislation he signed prior to that fateful day in November that created the system. And Kentucky got busy and became the first state to complete the network, that all 120 counties, thereby every Kentuckian has access to services, whether it's, again, mental health, addiction, or development and intellectual disabilities. And we still do that today. We have 14 mental health centers. Their regions really look at the ad districts. There's 15 ads, one region has 2. I tell people, folks, Fire West, Representative Imes, the ad districts got Livingston County wrong. They put it in 2. It should have been in 1 like the mental health center did. So Livingston County is the only difference that we serve. But the real takeaway is the 180,000 people we serve and support. That's what drives us. And we try to get, whether it's early childhood, first deaths program, birth to 3, school age kids, young adults. You heard about young adults earlier from Stephanie and Donna. Kids transitioning out of school. What can we do to help them? We provide services in 80% of public schools throughout Kentucky, adults, seniors. One thing we're trying to do more of is veterans. Veterans are pretty hard to get. They don't necessarily want to come to a mental health center, but we're working on veterans as well. But the real takeaway are those folks that we serve. That's what drives us. Shameful disclaimer, I got to say this, I'll be reprimanded by my board of directors. We are a quasi-governmental entity, and we participate in public pension. And I want to talk about the people we serve, but public pension is probably our #1 issue for, I don't know how long now, Sheila, a decade. People on the phone, it's public pension. So just so you know, we pay attention. As I tell people, I care about the folks we serve, and I dabble in public pension. But any question you have about the pension system, feel free to contact me. I'll tell you where we're at. But remember that 1 in 25, every kid in the classroom, one of those kids access serves a mental health center. Appreciate you being here. Thank you.
Thank you, Steve. I might also point out that we're looking, as you all are hearing, about an uptick certainly in mental health issues and in addiction issues during this COVID time. So we know that depression and anxiety, for some people, PTSD, people are self-medicating with alcohol and other drugs. So the CMHCs are busy, and they're providing services through telehealth, which has turned out to be a wonderful access, because as you all know, particularly in the rural counties, transportation is a huge problem. And this way people can get on their computer or even on their iPhone and see a therapist or get some counseling in a crisis without having to leave their home. So telehealth has been a huge part of that.
Yep.
So thank you, Steve. And now let me turn to our expert on brain injury. This is a fairly recent addition to the planning group around 874K. We've always been concerned about people with disabilities, but Diane Shermer has joined our group and has been instrumental in teaching us all more about the services that people with brain injuries need. So Diane, I'll turn it over to you.
Thank you so much for having me, and I'm very thankful to have the opportunity to be here with everyone. I am part of the Brain Injury Association of America, which is actually in 36 different states across the country, and the website for that is the Brain Injury Association. It's biausa.org, and we are very happy to be in Kentucky. I don't know if many of you know that there are 5.3 million individuals living in this country with a disability related to their brain injury every day. And for those of us that walk and talk every day, it's the leading cause of death for older Americans. Many of us fall into that category now, unfortunately, as well as very young children today. And we're very excited to be part of 874K because it's an opportunity for us to work with other groups that serve individuals who have different learning abilities and different disabilities. And I think that together, united we stand, divided we fall. And many causes that we look at for individuals that we need to advocate for are things that we can partner with, whether it be mental health issues or substance use issues. And as I've worked in brain injury for 30 years, what we've seen with the population as it's changed is that we see a higher percentage of individuals who come to us who are struggling with substance use issues as well as a comorbid condition of mental health issues. And so in Kentucky, we've been working closely with the legislature and also with the Department of Medicaid to help them understand that we shouldn't treat those things separately. They have to be treated together. And we have to combine expertise between us who know brain injury and other colleagues who can combine substance use expertise as well as mental health expertise and put those together. And a lot of things that we're doing in this state today are working with Medicaid to look at revamping the waivers so that we can better address the full continuum of needs for individuals with brain injury. We're also working to improve services for veterans, and we're actively involved with the Senator or Congressman Barr's Veterans Affairs Committee and the VAC here in Lexington. And we've just been awarded the military grant at the state level. We're also working here in Lexington to look at domestic violence and what brain injury does to individuals, whether they're females or males, with strangulation, as well as having their heads, whether it be hit against concrete or a wall, and the resulting brain injury that occurs, and how we might be able to influence how people are handled in the shelters to make sure that we meet the needs of their cognitive disabilities as well. And so being part of 874K Day is a privilege from my standpoint, to be able to work with all of the people who have spoken before me so that we have the opportunity to create greater awareness about how to meet the individuals that we serve every day, and also to have an opportunity to educate people on what is often misunderstood about brain injury and misdiagnosed about brain injury as well. And I will also share that my father had a brain injury years ago. I started in brain injury when I was 5, actually, but I trained in the Houston Medical Center, and he had a brain injury. And so I've sat on both sides of the table and certainly understand what it's like to be a family member as well as a professional. So I feel very grateful every day to wake up and have the opportunity to work with individuals who I have an opportunity to hopefully make a difference in their lives each day. So thank you.
Thank you so much, Diane. We sent you some information, and one of those was a kind of quick and easy sheet to look at in terms of what we advocate. As you can imagine, Medicaid is hugely important to us, and you've heard several of our speakers talk about the Medicaid waivers. I believe that the governor's budget and perhaps House Bill 192 at this point has some expansion of some of those waiver slots, we call them. And we really urge you to make sure that those are fully funded. We really have long waiting lists for many of those waiver services. It's the waiver services that allow people with significant disabilities to stay in the community, as David pointed out, and not have to go to a nursing home or an intermediate care facility for people with developmental or intellectual disabilities, which cost the state so much more. And we know our folks are happier if they can stay in a community of their choice. So we direct your attention to that. Let me open it up at this point and see if any of our guests, any of the legislators have any questions that they would like to ask at this point.